Hello, I am Tu Kim Lam. Welcome to the Medical News Show from Washington, D.C. On this edition of the Medical News, we will talk about GERD or Gastroesophageal reflux disease, commonly known as acid reflux, and the updates information on the medication for treatment of this disease. GERD or gastroesophageal reflux disease is an indigestion disease which affects 1/3 of adult Americans and Asians on different levels of severity and at least once a month. Here with us today is Dr. Tran, who is currently practicing internal medicine in Fallsburg, Virginia. Dr. Tran will talk with us about GERD and the update news on the medication for treatment of this disease. Welcome to our Medical News Show, Dr. Tran.
Yes, welcome to the medical news today, and welcome, Mrs. Lam.
Thank you, sir. Dr. Tran, today we're going to talk about GERD, commonly known as acid reflux. But first of all, can you explain to our audience what is GERD or acid reflux disease?
Yes, GERD is the very well-known names, or reflux esophagitis, or GERD means gastroesophageal reflux disease. That the disease causing by the content of the stomach regurgitated back to or back up to the esophagus instead of staying in the stomach. And when the acid go to the esophagus, they cause damage of the inner line of the esophagus, causing inflammations, and all we call esophagitis. And to understand fully what's really happened, and look at the first pictures on the screen. You will see on the left side when a person swallow a piece of pizza. Then we go from the esophagus to the stomach and pass to the sphincter, meaning the end of the esophagus is acting like a valve. They will open and close when the food passes through the stomach. When that really doesn't function very well, you can see on the second pictures on the screen, you see the opening of the end of the esophagus that trigger the reflux of the acid, the yellow liquid in the stomach, back up in the esophagus and causing damage of the esophagus and causing the disease we call reflux esophagitis.
So GERD has been recognized in the past 3 decades in Europe as well as in America, and especially it's on the rise on the Asian countries, Vietnam in particular. Would you please explain to our audience why the medical circle started to pay more attention to this disease only recently?
Really, we know the disease for a long time, but in the old days, we don't have any medication to treat the disease until we know more about the underlying cause of the disease and we develop more medications to treat the disease. Therefore, right now, most of the people are able to recognize the disease through the only news and the communication through the online internet. But mainly because right now we have more medication to treat, and also we have some kind of treatment by using surgery if the medication really doesn't work on these group of people who are having the disease. That's the reason why.
So can you tell us what the causes for this disease?
Mainly the cause is because of the weakness of the sphincter. I mean, the end of the esophagus, we have the sphincter that will open up like a valve. When that happens, because the weakness of that sphincter, or some other reason because of the other effect of the food, the medication, like causing the very weakness of that sphincter and causing disease because it will open up. The other factors also, if you look at the pictures on the screen, you can see at the end of the esophagus, you can see the sphincter is working like a valve, it's closing every time we eat. But then the second picture, you can see a small portion of the stomach go up to above the diaphragm. Diaphragm is the big muscle dividing the chest and the abdomen. When the stomach go up like this, we call hydrohernia. That part of the story of the reflux, because the acid may go up and causing some problem for the esophagus. And thirdly is, and because when the stomach is so distended for some reason, because the contraction of stomach is weaker, or some kind of medication that decrease the action of the stomach, or people eat too much for a long time, that may also the underlying cause of the reflux. And fourthly, because some people, when during pregnancy, the uterus getting bigger and bigger, and they push the stomach up to the chest and causing the disease. So mainly from the way we eat and from the hydrohernia, and also because of the distension of the stomach and causing the disease.
So can you describe the symptoms of this disease so our audience can recognize the
The symptom really is very complex, because it's from very mild symptoms like it's just heartburn. People have heartburn because the acid is really burning the end of the stomach, and really very similar to the symptom of the heart attack we call angina. And most people wake up during the night because of the chest pain and feel like some kind of burning inside, we call heartburn. Therefore, some people, they may go to emergency room to find out whether they have a heart attack or not. Yeah. But the other symptom is sometimes similar, like at night they have trouble breathing, or they have some wheezing because the mucus in the stomach go up to the throat and go to the airways and causing asthma-like symptom like wheezing, short breath. And people sometimes just have a lot of mucus in the morning and could not talk, has some hoarseness. These are the symptoms related to the same disease because of the acid. Acid will go up to the esophagus, causing pain, causing the problem in the upper part of the throat, and also go to the lung, causing asthma as well. So this is a very important disease and trigger a lot of symptoms for the patient.
Sir, GERD, you just mentioned above that GERD is very easily misdiagnosed and oftentimes confused with other indigestion disease, such as heart disease. Would you please tell us how a diagnosis of GERD is made of so that a person can seek for correct medical treatment?
Yes, nowadays it's like over 30 years ago, and people were already using the old technology to make the diagnosis of GERD. And we use, we call upper gastrointestinal series. This means we ask the patient swallow the barium, the contrast agent, and swallow slowly, and take the picture in series so we can see the esophagus has function. It goes down to the stomach to observe any lesion of the end of the stomach, and also see how the acid in the stomach may be reflux or not, or recognize some kind of ulcer stomach. That's the old way. Is these technology cannot detect most of the GERD because we cannot see the lesion, and especially when the GERD is still in the early stage or mild. And then with the technology, we have the endoscopy, mean they put a tube, a small tube into the esophagus with the fiber optic, meaning the light go through the fiber at the end of the tube and look at the inside, and then observe and maybe take the some small bits of the tissues of the stomach to identify the lesion. So with technology, we detect more and more the GERD diseases. But sometimes it's so difficult, we need to rely on the new technology. Means we have to put a small tube in the esophagus with the sensors at the end to transmit all the information about acid in the stomach through the recorder, put outside the patient. If that not able to do it because the patient cannot tolerate the wire in the esophagus, we have to put a tiny sensor in the form of the capsules, like a pill, to stick into the esophagus, and then they will transmit information to the sensor outside. And after 48 hours, it will come down the stomach and pass through the intestine. So that's the newest technology to detect the disease. It's very, very good to detect any form of GERD, especially in difficult cases.
Thank you, sir. Sir, in case if a patient does not know he or she got GERD and remain to be untreated for a long period of time, what can be the complications and how dangerous would this be to the person's health?
The complication is very severe because most people really cannot recognize the symptoms. And then when it go for a long time, the acid causing chronic inflammation of the esophagus causing chronic esophagitis. When that happens, they will form scar around this area and causing the strictures, meaning it's narrowing of the esophagus, and causing dysphagia, meaning the baby not able to swallow or smoothly or have trouble with swallowing, especially the older group. And then thirdly is if you look at the pictures on the screen, they call Barrett's esophagus. When the inflammation is too long, it may trigger the transforming from chronic inflammation to cancerous form or precancerous. We call Barrett's esophagus. In these cases, need to be followed up closely, get a biopsy done quite often to detect early cancers of the esophagus. And lately, you can see the pictures of the cancer of the esophagus so severe. This is difficult to treat, especially at the level of esophagus. These are the very, very serious complications of this disease.
Thank you, sir. Please tell us what are the current treatment that you're using to treat this disease right now?
Well, the treatment right now, we have only three. That means first, very important, is the lifestyle changing or diet modifications is very important. And secondly, using medication, especially the PPI group that we want to talk about, and the long-term side effect and everything related to that medication. And thirdly is surgery.
So let's talk about lifestyle change or diet modification.
Lifestyle changing is the key, very important to treat the disease, really, because the stomach is working, getting the food and digest and everything. So the first thing first is, because never eat too much. You have to reduce the portion of the food to the lower levels and don't eat too much in one time. And never try to eat before go to bed, especially 3 hours before bedtime. Then try to avoid such kind of food related that may relax the sphincter of the esophagus, like peppermints and chocolates and things like that. And especially the spicy food like onions and garlics and pepper. Anything that may trigger the increased acid in the stomach, we have to avoid. And then we have to come to the levels that we have to divide the food into release in regular. Like one meal have to really space to 6 hours to the next one, so the stomach may have some time to rest. That's the whole things we need to be careful about. The way we eat and the diet we use, and especially avoid completely alcohol and strong caffeines and things like that.
So we talk about diet control. Now the next step is medication.
The medication throughout the years and for the last 30, 40 years, and we see the progress of all the medication. The first group is called antacid, is still very popular right now. Antacid means against the acid in stomach. For instance, very popular over the counter is Maalox, Rolate, Tums, and everything. The function of these medications is to reduce acid in stomach. Some people feel good because when they got heartburn, stomach upset, they take these pills, they calm down because the acid go down. But really, these medications cannot cure the disease, and therefore, afterwards, like about 30 years ago, we talking a lot about the new medication called histamine H2 receptor antagonists. And histamine receptors mean the receptor to receive the signal to make acid for the stomach. When we block that receptor, they will decrease acid in the stomach. Very popular Zantac, Tagamet, Pepsid. Right now, we can buy over the counter. But the most effective medication right now we're talking is PPI, called proton pump inhibitor. What does this mean? Proton pump means the pump in the gastric cell. The function is to pump the acid out for the stomach to use. When we block the pump, we decrease the acid in the stomach. That's all it's about. And we have different medication right now in the market like Nexium, Protonix, and Prilosec, and all kind. We have very popular, very effective medication, but it also has some side effects related to that.
So we talk about diet control, medication. Now let's go into the last option, which is surgery. Can you tell us about that?
Surgery, we have only two options, and the first one is called fundoplication. What does this mean? Fundus is the fundus, the upper part of the stomach, and plication means the process to make this around the esophagus. If you look at the screen, because it's difficult to understand if you don't know the medical term and how the stomach look like, you can see the first pictures are talking about the esophagus go down to the stomach, and they call esophageal from the reflux. And the second image next to that is you can see the hydrohernia. And the fundoplication means we use the stomach, the upper part, wrap around the esophagus to narrow down the lumen of the esophagus to decrease the reflux. Because when we make the esophagus a little smaller, narrower, and we can prevent the acid to go back to the esophagus. That's basically the surgical approach right now. Quite popular, effective, but still have a lot of side effects related to surgery. And then if we don't have that kind of option, we do the endoscopy surgery, meaning go down to the stomach, to the tube, and get you different chemical, inject some kind of medicine around this area to causing narrowing of the esophagus. That's the second option. It's still not effective. Still have a lot of studies need to be done before we can use that for a lot of people.
Thank you, sir. You mentioned about the new medication that PPI or proton pump inhibitors. Based on the update news information on the medicals, when the patient stops using this medication, the disease will recur. Will you please explain to our audience why this is happening?
Yes, it's very important information about the PPI that the communities and the patient need to know, especially physician as well, because after so many years using and suppress the acid with the PPI, the most experts and most the clinicians recognize that when the patient stops taking the medication, the symptoms come back in the short time. The reason why, because when we suppress the acid in the stomach, it triggers the second the chemicals in the body called gastrin. The gastrin had the function to recognize how high and how low the acid in the stomach. When it's low, the gastrin will increasing, but when the acid is high, the gastrin will decrease. The gastrin will stimulate a different kind of cell to stimulate the acid the other way. So therefore, when we suppress the acid for a long time, the gastrin is suddenly we stop the medication, gastrin will go up very high and stimulate more acid, and the disease come back. And people seem to be not able to get off the medication, have to take medication for a long time. That's what happened in reality, because most people come back asking the same medication because they feel like they're not really getting better or get worse sometimes. But really that's because of what we call rebound phenomenon. When we stop the medication, the disease get a little bit worse because we cannot control the acid in the stomach. The secondly issues happen when we suppress acid in the stomach. We block the action of the acid because the acid will kill all the bacteria from the food, pass through the esophagus to the stomach. When we do that, some of the bacteria may pass through the stomach, go down to the intestine, and later on can grow and causing problem for the intestine. And the study done in people with nursing homes show that people taking antacid or taking the Zantac or taking PPI develop more infections of the throat and the lung than the regular group of people. These are the complications or the long-term side effect of the PPI that I think we need to be aware of that.
So how long does a patient have to be on medication, and what are the side effects?
The question right now really, most experts recommend it if the symptom is complete control, we try to stop the medication in short term as much as possible. And then if in few cases we need the long-term medication, like people have severe disease, have the disease that have tendency may be transformed to cancer, these people need to take long-term medication. And whenever the physician decide to discontinue medication, they have to process of tapping down. I mean, this is slowly take off the medication instead of suddenly stop medication to prevent the rebound phenomenon that the symptom come back.
I see. Sir, before closing the medical news show today, would you please give our audience some general advice on the acid reflux?
Really, my advice to most of the audience is, stomach is working for all our life. If you maintain it, I think you can keep it working longer. So eat regularly, eat small, don't eat too much in one time. Avoid anything that may trigger some problem for the stomach, spicy food, chocolate, peppermint, chewing gum, whatever. And then try avoid alcohol and too much caffeine. I think that's the better advice, not just for this disease, but also for most of the problem related to stomach in the future. Yeah.
Thank you so much for being with us today, sir.
Yeah. And thank you for listening to the medical news today. I just want to let you aware that because the medical knowledge is changing with time, with technology, with new studies and new knowledge. So what we present for all of you today could be changing in the future. And therefore, we have to keep up our information and to make sure that for medical knowledge, things will changing. And we have to keep up with that to make sure that everything we know is correct and able to apply to our life and able to use it in daily life and in terms of medication and the medical issues in our life and our family.
Thank you so much for being here today, sir.
Yeah, thank you for watching the medical news today. And again, thank you, Mrs. Lam.
Thank you. That was Dr. Tran, who just shared with us some information on the GERD disease and the latest information on the medical treatment for this disease. We hope that the information provided by Dr. Tran has shed more light on this disease. That is all the time we have for the medical news. Thanks for watching. I am Thu Kim Lam. We'll see you next time on the Medical News Show.